Okay, this video is called the hand ruler, and it's just about your hand. If you look at your hand from the distal fingertip of your index finger to the first crease, that's 1 inch. To the next crease, 2 inches. To the next crease, 3 inches. To the long curved crease here, 4 inches. Each inch is 2.5 centimeter. So basically, you can measure stuff. And why does this matter? Well, you know, I did a surgical internship, and I'm always on the phone calling my senior resident, sometimes calling an attending, and I'll be describing skin lesions, scars, all kinds of things, and I have to be able to tell them how big it is. So I always put my finger on the patient or next to the patient, and I would, you know, estimate it from that. These letters are, this is the distal interphalangeal joint, okay? I usually call it the DIP. This is the PIP, proximal interphalangeal joint between the phalanges, the fingers, the bones of the fingers. And this is the M for MCP joint. But all you got to go is by the creases. And then, you know, again, 1 inch equals 25 millimeters. Pretty easy to do. And you can measure anything on the human body. Pretty much, you know, anything bigger is even easier to describe. All right, so I got one more slide here. This is just coins. And this is pretty helpful. Especially, the most helpful coin is the quarter. A quarter is 1 inch, which is 25 millimeters. So that's really all you need to know. You can think of a dime as being about 1.5 inches. I'm sorry, 1.5 centimeter. But the quarter is the one that I find helpful. And you know, sometimes you'll describe other things, but then it's not. You don't have to be so precise. And a lot of times you hear it come up with description of tumors. You know, anything over a centimeter, in McDougall's words, is likely metastatic already. And usually you can't see it until it's at least a centimeter in size. So most of the time when you diagnose a cancer, it's already metastatic in the sense of micrometastatic. The PET scan might be negative, etc., but there's often micrometastases, and the only thing that's going to remove that is your immune system. Okay, so that's why you want a good functioning immune system. So you want to avoid high fat, you want to avoid high sodium, you want to have your immune system have good blood flow, and you know, other things can potentially impair immune function, like excessive mercury coming from amalgams. We'll talk about that some other time. So anyways, purpose of this lecture was the finger ruler. 1, 2, 3, 4 inches. All right, hope you